Now the present slide, what we are seeing is the stomach at the level of the fundus. This is very important. Remember, this slide is of the stomach at the level of fundus. Now what are the important points you have to observe in the slide that belongs to the stomach at the level of fundus? Now first thing is you have the mucosa, then you have the submucosa, you have the muscularis externa, but you can see here the serosa is not visible. Okay, so the stomach has got 4 layers: mucosa, submucosa, muscularis externa, and then serosa, which is not seen in this slide. Now we will see what are the important identification points of stomach at the level of fundus. The first thing is the gastric pits, presence of gastric pits. You can see there are a lot of pits. These are the gastric pits. So the gastric pits are shallow, they are not very deep. You can see the gastric pit extending from here till only here. So this is one gastric pit, one more here, one more here. So the gastric pits are shallow. You can compare the gastric pits with the muscularis mucosa. So you can see the well developed muscularis mucosae. With this level, if you see the gastric pits, they are very shallow. You have to compare the depth of the gastric pits with the muscularis mucosae. So it is very shallow. The second thing what you have to see is the lining epithelium. The lining epithelium of the stomach is simple columnar epithelium. You can see it is simple columnar epithelium. The lining epithelium is simple columnar epithelium. So first thing what we saw is the gastric pits, which are very shallow in the case of stomach at the level of fundus. Then you see the lining epithelium is simple columnar epithelium. The second thing what you have to see here, they have long fundy glands. You can see the length of the fundy glands are quite